So hip arthroscopy is a procedure where we use a camera, we put it inside the hip joint, and we're able to look at all the structures on the inside of the hip joint, including the labrum, which is like the lining of the hip joint. It's like an O-ring around the socket of the hip. We look at the cartilage inside the hip joint, and we can also look at the capsule as well. We can come outside of the hip joint a little bit and also look at the femur and the acetabulum. So essentially it's a tool that we can do the procedure minimally invasively to deal with all the pathology that we see in the hip. So symptoms of the pathology that we usually treat with a hip scope are usually pain located in the groin area. And that's like the classic pain, and patients will grab their hip joint, and usually it'll be kind of in that groin area. But you can also have pain around the posterior aspect of the hip as well. Pain more when you flex your hip up and kind of internally rotate the hip, so kind of bringing the hip up in towards your chest. And when you have pain there, that's a classic sign that it may be something that would need a hip scope. Pain with sitting for long periods of time, pain with athletic activities, cycling and running and things like that. Those are your classic symptoms. Sometimes people will have a popping sensation inside the hip joint as well, and that could be a sign that you might have a labral tear or impingement. I have a lot of patients that come see me. They may have been in physical therapy for a little while, and they'll ask, I wasn't sure if I should come see a doctor. And I always tell them, I think it's a really good idea to come see me as early in the process as possible. And because that way I can help diagnose the condition and what may be going on. We can get more imaging if that's needed. And then if we need physical therapy, we can help guide the therapist on really specific types of things that we want them to be doing. And then we can have communication throughout the whole process. So really, as early as you can, if you have that hip pain, and that could be as early as a couple weeks to get started in the process. So during the procedure, you'll come into the hospital, you'll meet the anesthesiologist, you'll meet myself, and we'll get you all ready for the surgery, okay? And then you'll go back to the operating room, and a lot of times we'll do a nerve block that can help with the pain during the procedure, and so they don't have to give you as much anesthetic during the procedure. You are asleep the entire time, so you're not awake and you won't feel or remember anything from the procedure. And then we put some special boots on your feet to allow us to pull traction on the hip joint. We don't have to use a post between the legs or anything like that. We have a special table that allows us to pull the traction without that. And then pulling that traction, we're able to put the camera inside the hip joint through two small poke holes on the side of the hip joint. And then we're able to do all of the work. At the end, it usually takes about 2 hours, and then at the end of the procedure, we'll put the hip joint back in the socket, and then usually put you in a brace, and then you'll go to the post-operative area. So hip arthroscopy is recommended for things like labral tears of the hip. And usually a labral tear is caused by either one of two things, usually femoral acetabular impingement, which is where you have too much bone either on the femoral side or the socket side so that it's pinching, and that labrum gets stuck in between. So that labral tear can cause pain, that pinching can cause pain, and so we can work through that camera to fix that. The other reason to get a labral tear is usually for hip instability, and that's where your hip might just be a little unstable that's pushing up on that labrum and causing pain and causing the labral tear. So we can work on both of those things. That's the usual reason to have a hip scope, is because of that labral tear, because one of those two pathologies. So you may be a candidate for hip arthroscopy if you have persistent pain in around the hip joint. And usually that is located around the groin area, but it can be more posterior as well. And I think it's just a persistence of those symptoms and not getting better with non-operative treatments that makes you a candidate for hip arthroscopy. Really, FI again, it's actually fairly common, and we don't know if it's something that you're born with or if you develop it as you're growing. But it's just an abnormal growth of bone around the hip joint. It can be on the socket side, which we call a pincer, so it's kind of like the socket that's out a little bit too far and it hits against the bone, or on the femur side, which we call a cam lesion, where you just have a big bump of bone on that side. And it's where those two hit each other, and that usually causes pain in the groin area. So recovery for a hip scope, usually, in most cases, will allow you to put full weight on your hip after surgery. And I'll give you some crutches just to help you get around and stuff after the surgery. And we usually use a brace to help protect you a little bit after surgery as well. So a lot of times I have patients come back into clinic at 2 weeks and they'll be off the crutches. Sometimes they'll still be using the crutches for a little bit, but bearing full weight on the leg. Usually by about weeks 2 to 4, you're walking around, feeling more normal walking, not having a limp as much. From weeks 4 to 6, walking around without much pain in the hip joint. Straight ahead running, we usually do that at about 3 months, and that can be a little bit earlier and a little bit later depending on your hip. And then return to athletic activities, things like playing basketball and soccer and things like that, are usually more like 4 to 6 months. So it really depends on the type of activity that you're doing. If you're an athlete and like you're playing a team sport, for example, playing soccer or football or something that's requiring a lot of cutting, pivoting motions, then return to that sport at that full level might take you about 5 to 6 months. If you're just wanting to get back to running and recreational activities and things like that, that might happen a lot earlier, maybe somewhere between 2 to 3 months, and it just depends. But again, normal walking, and if that's what you enjoy, you might be able to be back to that as early as 4 to 6 weeks. So the long-term outcomes are actually very good, and it just really depends upon the pathology that's in your hip joint. The one thing that we do know, that if you start to develop some arthritis in your hip joint, and we can see that on x-rays pretty easily, if you start to develop that arthritis, then the results of a hip arthroscopy are not as good, and that's where we start thinking about doing hip replacement surgery. But usually if you still have good cartilage in the hip joint and you just have a labral tear and impingement and things like that, we're able to fix that, and people are able to go back to doing all the things that they like to do. Sometimes this is a bilateral condition and we'll do one hip, and a lot of patients do come back and end up getting the other hip done because they have good outcomes with the first one.